Steps have been taken to close down 5 schools in the Sitavaka Education Division for 3 days from today, owing to a spike in the spread of dengue fever. The most recent dengue-related death from the area was reported yesterday. Newsfirst Joel Outskun joins us now with more on the situation.
A spike in the spread of dengue has been reported from Hangwala and the surrounding areas. One death has been reported so far, while numerous dengue patients have also been reported.
Sisira Kalna Samarasinghe, a resident of Vidyalamawatha in Hangwala, passed away yesterday while being treated in hospital for dengue fever. He was 22 years old.
We cannot recover from a tragedy like this. I ask that all people be committed at all times to prevent such tragedies.
Area residents had this to say on the situation.
I would like to request to take more rigorous approaches to eradicate dengue.
We had taken many steps to eradicate dengue as it was unsuccessful. I would like to request officials to take adequate steps to eradicate dengue.
Considering the spike in the spread of dengue in the area, steps have been taken to temporarily close down 5 schools under the purview of the Sitavaka Education Division. Newsfirst, Ruan Sanjeev reports.
Although the school day commenced as usual today at Rajasinghe College in Hangwala, which comes under the purview of the Sitavaka Education Division, by 10 a.m, the decision had been made to temporarily close the school.
We were informed the day before yesterday that about 40 dengue patients have been reported from homes located around the school. One child had died as a result of the disease. A special meeting of the school development committee was convened last morning. There are 2,300 children at this school, and because of the fear that they too would contract this disease, the decision was made to temporarily close down the school.
Mayaduna College in Hangwala, the Pahatgama Roman Catholic College, the Lower Hangwala Junior School and the Malayadeva Primary School too have been closed for 3 days effective today.
Decisions were made yesterday and today to close down these 5 schools for 3 days and to free these schools from the dengue risk. The heads of schools convened the school development committees, and as per their prerogative, it was decided to close the schools for 3 days until Thursday.
The Minister of Health too commented on the closure of the schools.
Schools as well as those local government bodies under whose purview the schools come under, together with the relevant government regulatory bodies, should work together to address this issue. The eradication of the dengue virus was most successful once the presidential task force was put together. There are many ministries that come under the purview of the presidential task force. However, some of these entities are not carrying out their responsibilities. The Ministry of Education, through the various schools in the country, is implementing a dengue eradication program. However, the assistance of all stakeholders is required.
We visited the National Dengue Eradication Unit at the Ministry of Health to inquire into the spread of this disease. Let's unearth the truth of the matter.
අයිබෝන් වෛද්‍යතුමනි මම සිරස නිවුස් ෆස්ට් එකේ සංජීව මේ දවස්වල වැඩිපුර කතා බහට ලක් වෙන එකක් තමයි වෛද්‍යතුමනි ඩෙන්ගු රෝගය පිළිබඳව මොකද්ද මේ වෙනකොට ඩෙන්ගු රෝගය පිළිබඳව පවතින තත්ත්වය
සෑම වසරකම අප්‍රේල් මැයි ජුනි මාසවලදී අපි දකිනවා ඩෙන්ගු රෝගීන්ගේ වැඩිවීම
අපි සූදානම් බලන්නට පසුගිය වසරේ කොහොමද රෝගීන් වාර්තා වෙලා තියෙන්නේ සහ මේ වසරේ ගෙවුණු කාලය තුල කොහොමද රෝගීන් වාර්තා වෙලා තියෙන්නේ කියලා මේ පිළිබඳ සංඛ්‍යා දත්ත
32,063 dengue patients were reported from January to December 2013. The statistics of the National Dengue Eradication Unit show that 91 people died on the disease last year. From January to April last year, a total of 11,825 dengue patients were reported. The National Dengue Eradication Unit notes that while 7,205 patients have been reported this year, over 10 people have died of the disease.
වෛද්‍යතුමනි චෝදනාවක් එල්ල වෙනවා ජාතික ඩෙන්ගු මර්ධන ඒකකය ඩෙන්ගු මර්ධනය සඳහා ගෙන ඇති ක්‍රියාමාර්ගයන් අසාර්ථකයි කියලා. මේ චෝදනාව සම්බන්ධයෙන් මොකක්ද කියන්න තියෙන්නේ?
චෝදනාව අපි බැහැර කළ යුතුයි.
We must disregard this allegation. We have been able to reduce the number of deaths in the recent past. At the same time, we have received the cooperation of other ministries to restrict the spread of the disease. We can see the progress that has been made in the programs we have undertaken to eradicate dengue.
අප ක්‍රියාත්මක කර වැඩසටහන් වල ප්‍රගතිය අපිට දකින්න පුළුවන්.
හොඳයි බොහොම ස්තුතියි ડોක්ටර්. සංඛ්‍යාදත්ත වාර්තා කොහොමුණත් ඩෙන්ගු වලින් ඔබේ ජීවිතත් ඔබේ සමීපතමයින්ගේ ජීවිතත් ආරක්ෂා කර ගැනීමේ වගකීමක් හා යුතුයකමක් අනිවාර්යයෙන්ම ඔබටත් තිබෙනවා.